everyone, and welcome to this special event on what is the future of health for the Black community in the U.S. We have a number of special guests with us today, and we'll hear from them in just a moment. For this event, LinkedIn News partnered with the Global Black Economic Forum, ahead of the 2025 Essence Festival of Culture that's being held next month. The festival aims to lift powerful conversations on the future of work, wealth, health, and democracy. Please introduce yourselves in the chat and let the panelists know what questions you have for them. I'm Beth Kutcher, I'll be your host today. I'm the healthcare editor at LinkedIn, and you can follow me for more healthcare conversations or subscribe to my newsletter, Path to Recovery, which you can find by going to my profile or searching for hashtag Path to Recovery on the site. And now, I'm gonna turn it over to Alphonso David, who's the president and CEO of the Global Black Economic Forum. Alphonso, thank you for being with us today.
Beth, thank you so much. Welcome, everyone. Good afternoon, good morning, depending on where you are. Thank you for joining us today. We are joined by some fantastic guests in the medical field who are not only experts in their respective areas, but they're visionaries for getting us to really rethink how we approach our health and how we achieve meaningful outcomes for people of color and specifically the Black community. As you heard from the introduction, I'm the president and the CEO of the Global Black Economic Forum, where we focus on advancing the interests of marginalized communities, specifically through 4 pillars: the future of work, the future of wealth, the future of health, and the future of democracy. Today, we will be focused on the future of health, which is so key and central to whether we can work, whether we can generate wealth, frankly, whether we can successfully participate in society civically. Our health is inextricably linked to economic opportunity, agency, and longevity, which is why we at the Global Black Economic Forum have made elevating health equity as a strategic focus. We will be engaging with millions of people this year at the Essence Festival of Culture, where the Global Black Economic Forum will be hosting panel discussions, activations, engagements, with business leaders, policymakers, medical experts, and members of the public on how we can advance the future of our health. In short, we believe that we have the collective power to imagine, build, and implement solutions that work for all of us. And in so doing, we can create an economic, cultural, and moral framework that benefits all of us. With that, it is my pleasure to introduce a stellar panel for today's event. I will ask each of them to introduce themselves, and then we will engage in the conversation. We will start with Mr. Mathew Knowles.
Hello, thank you, Alphonso. I love what you said. The fact is, without health, there's no wealth. Let me say that again. Without health, there's no wealth. But I'm Mathew Knowles, and I'm very glad to be here.
Thank you, Mr. Knowles. Next, Dr. Aletha Maybank.
Good afternoon at this point, everyone. Great to be here. Great to be in conversation. Aletha Maybank, pediatrician, preventive medicine doc, have worked in governmental public health, have worked in large organized medicine associations across the country, and have been supporting Global Black Economic Forum and other cultural entities and figuring out how do you actually leverage culture to advance health. That is where people are at. And I think as health professionals, it's an opportunity for us to connect better and understand that and understand the systems and the pathways that actually bring us joy often as it relates to culture. So I look forward to the conversation today.
Thank you. Dr. Joneigh Khaldun.
Yes, good to be here with everyone today. I'm a practicing emergency medicine physician. I've spent time leading local and state governmental health departments, a state Medicaid program, have worked in corporate America, one of the largest corporations in America. And now I'm the president and CEO of the Public Health Accreditation Board, which really sets the standards for and holds accountable health departments for providing high quality services across the country. And so for me, I sit in the clinical medicine space, in corporate space, in the nonprofit space, in the governmental public health space. And so thinking about how all of those systems work together to do better is really what excites me and what I'm looking forward to talking about today.
Last but not least, Imamu Tomlinson, who is also a doctor and a CEO.
Thanks for having me. I appreciate you. So I'm Imamu Tomlinson. Everybody calls me Moo. I'm the CEO CEO of Vituity. Vituity is a multi-state, multi-specialty physician practice with over 5,000 physicians who are all partners. We have no private equity. I'm also the president of Vituity Cares, which is an organization focused on bringing health to underserved and underrepresented communities. I'll just say one thing. You guys have said so many amazing things. I'm looking forward to the conversation. But I think it's our responsibility to make sure that we provide opportunities for everybody to impact and receive health, no matter who they are, where they're from, or what they look like. And so I think that's a mission for Vituity, myself, and I think, hearing what y'all have done and what we'll talk about today, I think it'll be a great conversation.
Thank you all. Mu, why don't we start with you? You are a CEO, you are a physician leader, and you oversee the care for thousands of patients, many of whom are facing the hard realities of a system that unfortunately is not working well, certainly not for Black people in the country, and frankly, for many people in America. At this moment, what do you say to people about the future of health, both as individuals and for their communities? And how do you help them steer toward inspiration or hope that maybe there is something that we can look forward to that could potentially improve their health?
Yeah, a great question. For us, we see almost just over 12 million patients a year. Last year, 2024, we saw 12 million patients. And most of the time we see them in their worst situation, in the acute situation, in the emergency department or in the hospital. And I think what we're seeing is a transition of the care going from these large, huge hospital systems out in the community. And what we want to make sure is that, people, especially Black people, don't get left behind. And so my recommendation or a way that we can, convince people to take control of their health is to really empower them. Doesn't matter, how much you make or where you're from or what insurance you have. You should be empowered to ask questions, to challenge, to always ask questions about your particular health in your community. And I think if we continue to disrupt and challenge at every aspect, it'll empower people to get better care. I think a lot of the information knowledge, the AI, sort of infiltration will leave people behind if they just accept the care they're given or accept the situation they're in. So I would encourage people in this, time of consumerization to really go in and say, what is my care? Am I receiving the best care? Is this the right care? What does this mean for me? What does this mean for me as an individual?
So without getting too deep into information or misinformation, which unfortunately we have to grapple with so much, how do you collaborate, or who do you collaborate with, I should say, to make sure that the message that you just communicated to us actually sticks?
Yeah, I think times are changing. All of us know Joel, who is viral on TikTok with trying to manage misinformation, right? He's a good friend. Actually, he's kind of like my younger brother. But what I've learned from him and from others is that we may be partnering with the wrong people. We tend to be in these large sort of healthcare organizations, but we need to partner with TikTok and Instagram. We need to partner with those people who can influence at the very, especially in social influence and sort of marketing influence, which is a very different way to partner. So that's what I would say. I think the people that we should partner with are those that have influence in our communities, that those who are respected, athletes and entertainers, and others, so that we can get the message out.
So I want to build a little bit on what you just said. And Dr. Khaldun, I'm going to shift to you. You have led a major public health department. You've championed health equity at one of the nation's largest retail companies. And now you're leading the sole national accrediting body for public health in the United States. So this is a body that supports health departments in strengthening their infrastructure and their workforce and their data systems to better serve communities. As we're hearing from Mu about how we need to sort of take this message and make sure that it sticks, how do we make sure that we're communicating why this work is so essential, particularly for members of the Black community in the first place, right? We're talking about the messaging, but why is this work so important in the first place, specifically for Black communities?
Yeah, that's a really important question. So let me start with, before we start talking about kind of what the risk is to public health right now at the federal, state, and local level, I think it's important to just level set on what does your health department even do? And so your health department is the one who's making sure that children are getting access to lead test. If a child is exposed to lead, it's the health department who's following up with that physician office, working directly with the family, getting inside of the home, understanding where that child has been, and making sure others in that household or the broader community are not exposed. Your health department is leading the Women, Infant, and Children, or WIC program, making sure that underserved families have access to nutrition. It's your health department who oversees the programs that are supporting people who are living with HIV and AIDS. It's your health department who is supporting if there is an exposure to an infectious disease at a restaurant, making sure we're understanding that source of exposure and preventing others from being exposed. It's your health department who's making sure that if there is an exposure at a school to something like measles, that we know where that exposure is and that people have the ability to prevent further exposure and to be healthy. And also, it's the health department who's making sure vaccines are available for free for families who are in need. And so I could go on and on. And so the point is, your governmental health department is the one who is the backbone, often the silent backbone of public health, of general community health. And so what I'm concerned about is that when we see federal budgets who are stretched and cut, when we see state and local health departments who are cut and general budgets that are cut, what tends to happen is that public health is first on the chopping block. And what that means is that we will see an increase in incidence of disease for everybody, right? But we all know that when things hit hard, it tends to hit the Black community harder. It tends to hit people who are living with disabilities harder, those who have weakened immune systems, those who have underlying chronic diseases, those who are living in rural communities, those who are living in poverty. So I'm very concerned that what we're seeing is that we're going to see decreased budgets. We're already seeing this across the country, and we're going to have a risk of people across the country, but particularly in underserved communities and Black communities that have been historically underinvested in. We're going to see increased incidence of disease across the board. So I'm very concerned about that.
So, and we're talking about the changes, of course, the federal and state systems, and unfortunately the impact of the funding cuts that are having on our medical services. I want to shift just from that to talking more specifically about how this affects an individual. So, Mr. Knowles, I'm going to shift to you. Many people, of course, know you as a global icon in the music industry, and of course, as Beyonce's father. But what many people may not know is that you also spent time working in or adjacent to the health space, and your decision to share your personal health journey publicly, I think, is both courageous and deeply strategic, especially when we talk about the power of storytelling in shifting health outcomes. Moo talked about how we need to make sure we're getting the message out and how it sticks. But in a time when fear and distrust of health systems are running really deep in our community, your transparency really offers people something powerful as a reminder that they're really not alone. And I would like to ask you if you can share a little bit of your story with us and tell us why you chose to go public and what the future of health really means to you, and specifically you believe for Black people.
Well, thank you, Alphonso. You know, most people don't know that I spent 20 years in diagnostic imaging, selling zero radiography in the 80s, which was the leading modality for breast cancer detection. Went on to be the first Black to sell MRI, and then went on to Johnson & Johnson as a neurosurgical specialist. Learned a tremendous amount in healthcare, knowing today that 1 in 8 women, 1 in 8 in their lifetime will be diagnosed with breast cancer. What we often forget is 1 in 8 men in their lifetime will be diagnosed with prostate cancer. And having that information, and in the 80s, really screaming as high as anyone would listen about the importance of early detections for breast cancer. And that same holds true for prostate cancer. And so given the opportunity, and it's amazing, one day in my training with Xerox Medical Systems, it was all male breast cancer, one day. And it was optional, but I chose to go to the training. And fast forward to 5.5 years ago, I had this discharge in my chest area, and I knew immediately what it was from my training. Called my doctor, really prestigious, experienced physician here in Houston, and he smiled and said, Knowles, no man has ever asked for a mammogram. But I had this sense, patient advocacy is one of the things, and the reason I'm bringing this up is the importance of patient advocacy. And so I got a mammogram, and sure enough, male breast cancer. Then as I had my surgery, a new word came up, and I was like, I'm not sure I know what that means, BRCA. What does BRCA genetics? I didn't know that. So it turns out that I'm BRCA2 mutated, genetically mutated, which means as a man, I have a higher risk of breast cancer, prostate cancer, melanoma, pancreatic cancer. So I've chose to go and tell my story, to be vulnerable, to be an advocate, proud, very proud to work as a global ambassador with Zero Prostate Cancer, very proud to work as a global ambassador with 23andMe in genetics, so I can go out and share this information, especially to our Black and brown people, especially to our Black men and our Black women. Again, 1 in 8 for men and women. And it gets even higher numbers when we look at mortality rate. So I think it's important that I share on my platform that I'm grateful to have because of my kids. It's important that I share this information.
What has been the feedback? And first, thank you for sharing your story. Can you talk a little bit about the feedback that you've gotten from members of the public about your story and whether or not people are really rethinking how they approach their health as a result of it?
Well, I can tell you I've been to many, many, many cities, in the airports and at restaurants, that people come up and Black men come up and say, thank you. I have that too. Or a Black woman say, thank you. My sister or my mother died of breast cancer. So I'm very in tune to what you're saying. And for some reason, and I don't know, maybe some of the doctors can talk, it appears that cancer overall is getting younger and younger and younger. So this whole thing about waiting till we get older in life, that's where genetic testing also comes in. But the ability to talk about these things and to share my story. My grandfather died of prostate cancer. My dad's 3 of his 4 brothers died of prostate cancer. I'm at higher risk of prostate cancer. So I just want people to know the early detection, to know that. That's the whole key to all of this, is blitz the barriers, which we're doing at Zero Prostate Cancer, where we want to hopefully save 100,000 men from this terrible, terrible, terrible disease of prostate cancer.
Mr. Knowles, thank you. Thank you again for sharing your story and for your advocacy. Which then brings me to Dr. Aletha Maybank, who I must say I had the distinct pleasure of meeting a number of years ago, and I was so impressed and remain impressed. She is incredibly thoughtful, very strategic, wickedly smart, and most importantly, deeply caring. And I want to also publicly thank her for partnering with us at the Global Black Economic Forum to launch and produce this year's Future of Health at the Essence Festival of Culture. Now, Dr. Maybank, Mr. Knowles' story and Moo's references as well sort of underscore the influence that culture and visibility can really have on health behaviors and outcomes. And you have certainly spoken quite powerfully about the opportunity to use culture as a lever to advance public health. Can you talk a little bit about, and connecting all of these dots, what does it mean that we are advancing this idea of the future of health, and how do we connect this idea of culture and visibility and improving health behaviors and outcomes? Or you're on mute. There you go. We can hear you.
Thank you. Still do it, as many times as we've been on Zooms, we still do that. But an honor to be here with you all. Alphonso, thank you for the very kind words. And it's been a pleasure, a tremendous learning curve for me, for somebody who's been, in other kinds of institutions, learning, what it's like to operate. We've always been at a quick pace, but this context of people and culture and media and what that all means and how to maneuver around it and being very specific around messaging and all that, it's actually very exciting and very new. And so what I'll say, I'm going to start at the place of this week is actually Juneteenth, right? In 2 days, the country will celebrate June 19th. And, the day of which we know enslaved people within Galveston, Texas, learned that they were no longer actually legally enslaved in 1865. And I think it brings up this, again, piece about culture, but also connected to history and the things that we need to claim and know about ourselves, I think is really important in the context of the future of health. So when I think about the work that we have to do and that I've done in the past around restorative justice work, that includes the context of reparations, and that's one conversation when I think about the future of health for Black people specifically. But the context of historical histories is part of that. How do we elevate the health histories that are both current as well as past in order to help inform us as well as inspire us to be better, to do better, not just by ourselves, but collectively? That's the beauty of this call. That's the beauty, I think, of the opportunity with the Global Black Economic Forum, is that I get to pull together people from the ecosystem, not just the silos that we're typically in as health folks. Sometimes we're just in the healthcare space, the public health space, the patient advocate space, but we don't always come together. And I think that that is really critical as we think about, again, the future of health, of how are we building the collective, how are we building solidarity so that we can all move forward together. And then the third part of that is what we're elevating here more so is the context of culture. Culture is where people are at. And I've learned over my career, and especially when I was at New York City Department of Health as deputy commissioner, they used to have these amazing campaigns, and most people have seen them, the smoking and tobacco ad campaigns that were very powerful, and the sugary beverage campaigns. They weren't just local, they actually became national and international. And I think about this context of what really moves people. Where do people go and when do people go? Why do people go? In terms of changing their behavior and understanding more information than they did before, and not just one person at a time. I'm a public health person through and through, but how do we do this more so as a collective? And I feel culture does that. So when I go back to those campaigns and saw all these people knew what these ads were at the same time, it was the power of the creation of using creative, right, to express this idea around people getting affected and what it felt like, what it looked like. That was impactful in itself, the messaging. But it was this context that it was known that in order to really deliver the message, you have to get it out to a lot of people, which means you have to put the investment and the resources into actually distribution of communications, and media is very expensive, but the health department poured multi-millions dollars into the space. The CDC gave New York City Department of Health money in order to really get this message out fully. So I think about the power of, reaching a lot of people. And I feel culture, when you don't have a lot of resources, and especially in a time like this, we also are in a time when we already clear our typical communication channels are being silenced, of where not only general people or everybody else is getting health information, but even where we as health professionals are getting health information, it is more difficult. So then there's going to be a greater reliance on people like us, right, in these spaces who are in the media, who are social media influencers, like the Joels, like all of everybody actually that's on here. And so how do we leverage our influence, partnering with culture where people are at, like a place like Essence, like a platform of the Sundown Media Group, but there are many other places. There's arts, there's all of that. How do we as health people better connect with that and leverage that value? Because that's where people are going to pay attention. More so, we love that people just do what we say, but we're clear it doesn't happen that way.
Well, I'm going to ask a question for all of you to respond to, and then maybe we will have a few minutes to see if there are any questions from the audience. Let's address one of the, I think, underlying tensions that we see in the health space, which is a persistent perception, maybe a reality, that institutions and maybe people who are leading them have not always been trustworthy. So the question that I want to pose to all of you is, How do we build trust, especially as new technologies like artificial intelligence and genetic testing, both, have been sort of alluded to in reference today, are becoming more central to our health and the journeys of how we interface with our future? So I will open up to see if anyone wants to tackle that question. How do we deal with the trust issue?
Maybe I'll chime in. Loving this conversation. Just the wisdom of my co-panelists. One thing I think is important, and you said being trustworthy. We have to be trustworthy, but I think part of that is also making sure people with diverse backgrounds, people of color, people with disabilities, make sure we actually have the knowledge and understanding of these new technologies. We know, for example, that when people of color have healthcare providers who look like them, we tend to see improved health outcomes. And so I think it's actually important that we make sure we are knowledgeable. Everyone's not going to be an expert, but take a class, join something where you can learn a bit more, so you can ask the right questions, so you can be at the table when people are making decisions about how these technologies and policies and programs around these technologies are going to be rolled out. I think it's really important that we not see these technologies as the boogeyman, but we lean into becoming experts in them so we can inform policies and programs moving forward.
And Mr. Knowles, in your conversations with folks around the country, how do you deal with this question about trust, people not being trustful of the medical field or institutions or doctors because of our history, whether we're talking about Tuskegee or something else?
I think you hear some of that, but for the most part, I don't personally hear that as much. I think people are wanting to get information. Knowledge is power. And once you gather the information and understand the power that you have as a patient, again, patient advocacy, those types of myths or information, we might say, kind of goes away. I really think it's so important that we get our own information and we build our own trust with our physician and healthcare community.
Okay. Anyone else?
Yeah, I'm gonna, I'm sitting here thinking and don't want to give too much of my personal journey, but I'm on a little bit of a journey as the only Black CEO in the space and taking care of this many patients, and I'm trying to bring some worlds together that are the things I love and believe in. Obviously, I'm a hip hop person, but I'm also the CEO of a $1 billion company, and so what I realized is incumbent upon me to start to speak to people in the way they can hear, and not just, be at the conferences and the healthcare conferences, but be in places where, I don't have to build trust with them, but I have to communicate in ways that people understand me. I can't always show up as Vituity CEO. Sometimes I have to show up as Moo. And so I think that, is a personal challenge to all of us. We're all doing amazing work. We're all, putting a lot of effort and emphasis into healthcare, both on an economic standpoint and a resource standpoint. But how can we change the way that health professionalism and health information and physicians are perceived in the community? We have to be of the community, by the community, and maybe not be so perfect. So I'm saying this as a recommendation, but I'm also telling myself, Moo, you got to bring these different entertainment, music, healthcare. They all should be together, because that's the way a lot of communities, but especially the Black community, that's the way they consume information.
And I think I'll just chime into that point real quickly, because I know we're at the very end of time, but I think that's the part where we have to be the bridge. We can't just expect people to know technologies and know how to access them. We have to help bring them, and we have to help explain them very directly to our patients, our families, and our communities as well.
Well, thank you all. I did check the chat to see if there were any questions that we did not answer, and it appears that we've answered all of the questions that were raised, or at least touched on all of the issues that were referenced in the chat. I want to very, very much thank Mathew Knowles, Dr. Aletha Maybank, Dr. Imamu Tomlinson, and Dr. Joneigh Khaldun for joining us today. And I think I need to now turn it back over to Beth.
And thank you, Alphonso. This was a really, really interesting conversation. And thank you to our wonderful and esteemed panelists. Please follow all of them on LinkedIn, go to their profiles to continue this conversation, especially leading up to next month's Essence Festival of Culture. As a reminder, I'm Beth Kutcher. I'm the healthcare editor here at LinkedIn. I hope you follow me as well for more great healthcare news, and subscribe to my newsletter, Path to Recovery. Thank you again for being part of our healthcare community, and have a great day.
Thanks, Beth.
Thank you.